you for joining this pre-op webinar. We're going to give it 1 minute until more people join and give them a chance to join, and I can get started. My name is Christian. I'm the nutritionist here at Mexico Bariatric Center. We're going to give it like a minute, 30 seconds to a minute to start the webinar. Give some more people time to join, and we'll go over the pre-op. Okay, let's get this started. So my name is Christian. I'm the nutritionist here at Mexico Bariatric Center. I have a Bachelor's of Science in Clinical Nutrition from University of California, Davis. This is my email, and this is my direct line. If you want to get in contact with me to ask any kind of questions, I'm more than happy to help. So please don't hesitate to contact me. And here's our tech talk if you want to get more information. So we're going to go over the purpose of the pre-op and the actual pre-op diet. So let's get into it. So the purpose of the pre-op diet. Losing weight is not the main goal on the pre-op diet. The whole purpose of the pre-op diet is to shrink the liver, begin behavioral changes. The weight loss is an added bonus, and then making sure that meals are a good practice for the post-op because they are very similar. That's why we want you to stick to the pre-op diet. It gives you a good sense of what the post-op will be also. And if you guys have any questions, please hold them until the end. I'll have some time to answer questions at the end of the webinar. So the way we select how long the pre-op diet is, it's based on your BMI. Like I said, this is the phase where you start to learn healthier habits. You focus on quality food sources. You ditch all the processed and fatty foods. And then patients who follow this diet have an easier time recovering. They have less incision sites, and also they learn portion control. Pre-op diet will consist of lean protein. You'll have 2 to 3 meals with 4 to 6 ounces of lean proteins. Some great options are chicken, lean ground beef, eggs, fish, salmon, lean steak, turkey. Edamames are a great source of protein, even though they're vegetable, have a very high amount of protein. Tofu and tuna. These are great options for your pre-op. You can't go over any of these. So you can choose whatever you like for your lean protein servings. For vegetables, you can have unlimited fibrous carbohydrates. These are vegetables you have limited amounts: cauliflower, cucumber, lettuce, broccoli, carrots. Pickles are also fine. A lot of questions that I get is if you can have pickles. Yes, pickles are fine. Most important thing here is to avoid starchy vegetables. Starchy vegetables are potatoes, corn, peas, squash, and pumpkin. You want to avoid these. They have very high starch content. It's going to help with you shrinking your liver and also help with losing weight if it does happen on the pre-op. Some healthy fats. You can have 1 to 2 servings of healthy fats. These consist of oils, avocado oil, olive oil, nuts, salad dressings. Just make sure you get a good quality salad dressing. One of the companies that I recommend you look into is called Skinny Girl. They have a lot of options for salad dressings, anywhere from ranch to balsamic vinaigrettes. Nut butters, so peanut butter, almond butter are also a great source of healthy fats, and also seeds. Pumpkin seeds, sunflower seeds are amazing as healthy fats. And they also, nuts and seeds can help keep you satiated. So if you want to have them as a snack, just have a handful of nuts or seeds, and those will keep you satiated in between meals when you're starting to feel a bit hungry, but it's not exactly time to eat another meal. These are some things to avoid. You want to avoid all starches. Bread, pasta, rice, tortillas, any kind of baked goods. You want to avoid all these starches. They slow down the whole process. Even after the surgery, I still ask patients to try to avoid starches. Generally, they don't have that much nutrient quantities, and they slow down your weight loss progress. You want to limit fruits to half a cup of berries, half a banana, or half an apple. Make sure you avoid all sugar. It's important to read the labels. Whenever you see added sugar to a product, you want to avoid that product for the pre-op. Processed meats like bacon, salami, bologna, sausages, or beef jerky, these ones you want to avoid also. You can have some turkey sausages, but it's important that you choose a high quality one. And like I said, you want to avoid potato, corn, peas, popcorn also. Pumpkin and squash are two of the other ones that you want to avoid. Dairy, any kind of milk, cheese, yogurt, or cottage cheese, you want to avoid that. Alcohol, you have to stop it 2 weeks before the surgery. And then any drinks containing sugar, soda, sweet teas. You want to discontinue carbonated beverages, period, but you can have sugar-free sports drinks, for example, Gatorade Zero, Vitamin Water Zero. You can have those on the pre-op. You have to discontinue all alcoholic beverages. Caffeine is also important. Coffee, teas, sodas, energy drinks, you want to avoid them. They can increase the chances of bleeding during the surgery. Make sure when you do choose to drink teas, you avoid black tea and green tea. They have high amounts of caffeine in them, and you want to avoid those for the 2 weeks before the surgery. You also want to discontinue vitamin supplements 2 weeks before surgery. You can start them again 2 weeks after the surgery. So we want to change your eating behaviors and also a little bit of a lifestyle change. This is a very important rule for post-op. You need to stop drinking 30 minutes prior to eating and do not drink anything until 30 minutes after the meal. This is very important. It's very good to start doing it on the pre-op. It's going to give you a good habit. If you do this after the surgery, complications may occur. Things like dumping syndrome can occur from this, as water or liquid during eating can speed up the process of gastric emptying. So you want to make sure you follow this rule. You want to get used to it. It's somewhat of a lifestyle change. A lot of people have trouble with this, but it's a very important rule to follow. Now I'm going to check your knowledge. I'm going to set up these 2 questions. So please, everybody answer. Let me just, So I'm going to launch the question right now. Everybody please answer. And then we can go over the right answers after everybody's answered. I'm going to give you a minute. Try your best. And then we can go from there. Thirty more seconds. Okay, it looks like almost everybody answered, so we're going to go ahead and end the poll. Most of you, 87% got the first question right, and then 91% got the second question right. Let's go over the answers. So is bacon a good source of lean protein? What about tuna? So bacon is not a good source of lean protein. Bacon is a processed meat. It has a lot of fat in it, so I would want you to avoid it for the pre-op. What about tuna? Tuna is an excellent source of lean protein. It has very little fat and it has a lot of protein. So that's a good way to get your protein levels up. You can do a tuna salad if you want. There's a lot of options you have with tuna. And when should you stop caffeine, vitamins, and alcohol? You want to stop caffeine, vitamins, and alcohol 2 weeks before the surgery. All these things can increase the chances of bleeding during your surgery and after when you're recovering. So it's a very important step. You want to stop them. If you are having troubles with caffeine, before this 2 week deadline, you can uh, mix half decaf coffee with half normal coffee to wean yourself off of caffeine. I know a lot of people have issues with caffeine consumption, and if they stop completely, all of a sudden they get headaches, and you want to avoid all kinds of side effects from this. So it's best if you wean yourself off of it early. Here are some excellent recipes for the pre-op. You have a roasted salmon with avocado salsa. Salmon has very good sources of protein and also healthy fats. Avocado is the same. Avocado is a great healthy fat, and this recipe takes about 15 minutes to make. You can use it to entertain guests if you like. And also we have the cucumber noodle Greek salad. This is pretty much just vegetables, like some chickpeas. Again, great sources of vegetables, fiber. Chickpeas have a lot of protein in them and also have some fiber. It takes less than 10 ingredients, and you can whip it up really quickly. You can make it in a big bowl if you want, and then share it. Protein supplements, they're very good for the pre-op. They can help with hunger, they can help with satiation. You want to look for protein supplements, either protein shake or protein powder. It has to be a minimum of 20 grams of protein. You want to have less or equal 5 grams of sugar, so less than 5 or equal. Whey isolate is great. That one is a clear protein that you can have even on the clear liquid diet. You can also have plant-based proteins if you'd like, egg white-based proteins. You have a lot of options here. Like I said, you can do the pre-made shake or the powders. Pre-made shakes are more convenient. The powders are, you can control how much you put in it. So you can put 2 scoops of the powder if you like to have even more protein. And the powders are usually cheaper. So if you want to do that, it's perfectly fine. The powders can also be mixed with water or unsweetened almond milk or coconut milk. If you want to do less calories, you can do it with water. But if you want to make it creamy, have a little bit more flavor, you can add the almond milk or coconut milk. These are some recommended protein powders. Like I said, it's very important that it has at least 20 grams of protein and less than 5 grams of sugar. These are vegan ones. Pretty much any protein powder or protein supplement that you want to get, as long as it has these two values of at least 20 grams of protein and 5 or less grams of sugar, they're fine. I recommend whey isolate. Like I said, it's more processed, it's absorbed better. That one, if it's unflavored, you can have it on the clear liquid diet also. And the benefit of the protein shakes or protein powders is that it has a high protein content and low fat content compared to, let's say, a piece of chicken. Chicken comes with fat also. So a protein powder or protein shake will have only protein and a little bit of fat because it's natural. It's made from milk if it's an animal-based one. So I recommend protein powders or protein shakes. It will help you a lot. You can have them on the post-op too, starting week 2. So if you want to stack up on these, you're more than welcome. And protein is very important in recovery. So 2 days before the surgery, you will go on the clear liquid diet. On the clear liquid diet, you can only have water, clear broth or bouillon. You can do either chicken, beef, or vegetable broth. I get a lot of questions about bone broth. Yes, bone broth is okay to have. Sugar-free water flavorings are fine. You can have either Crystal Light, but sugar-free, 0 calories. You can use Mio if you want. And there's a lot of liquid IV. Just make sure it's the sugar-free one. Those are all fine. You can have sports drinks that have 0 calories, 0 sugar. Powerade 0, Gatorade Zero, those are great. And if you want like a sweeter treat, you can have sugar-free Jello or sugar-free popsicles. These are also great. They provide some hydration without having the need to swallow just water. These are great if you're having trouble with water, or if you don't like water. Sugar-free Jello, sugar-free popsicles will be a great thing to have. And also, you want to look for some protein waters. These are a little bit different than the protein shakes or the protein powders, because they're made with water specifically, and they're more processed. It's easier by your body to absorb. Some examples are Gatorade Zero with protein. It's this right here. Protein 2O. This one is that I hear a lot of things about. And Premier Clear. Those are great sources of protein for the clear liquids. It can be used on the 2 days prior to the surgery, and it can also be used on the first week of clear liquids after the surgery. Yeah, another great thing that you should have stocked, so you don't have to worry about that. If you have any medical questions, please contact our surgeon liaison, Jen. Unfortunately, I cannot answer medical questions. So all medical questions, whether it is medicine, allergies, or general health questions, please email Jen. You can also call her at the phone number. She does answer emails faster and more consistently. So I think that's the best option if you want to ask a medical question. And now we're going to do another check your knowledge. So if everybody can answer them, I'm going to start the poll right now. Okay, the poll is up. Go ahead and try to answer the questions. We're going to wait another minute, and then we can go over the questions again. Another 30 seconds, and we can go over it. Okay, looks like almost everybody voted. So we're going to end the poll. Almost all of you got it correctly. So, can you drink protein shakes? Can you drink protein shakes during clear liquids? No, protein shakes, like I said, they're not made with just water and protein. They have some added milk. That's okay. I know we say no milk or no dairy on the pre-op, but protein shakes are the only exception. So you cannot have protein shakes during the clear liquids. On the clear liquid diet, you can have protein water. So this one would be a great example. Protein 2O, so protein water has 15 grams of protein and then 1 gram of sugar. How many grams of sugar should the protein shakes be under, and how many grams of protein should your shake contain? So the protein shake should be under or equal to 5 grams of sugar, and then they should have at least 20 grams of protein. I also get questions about protein bars. I do not recommend protein bars. They usually have starches added to them to make them more tasty. They have a lot more fat added to them to make it more cohesive and taste better. So I would suggest just staying away from protein bars. You can start protein bars if you'd like a month after the surgery. They're not bad necessarily. It's just for the purpose of the diet, I want you to avoid them. Now we're going to talk a little bit about bariatric vitamins. So it's important to discontinue all vitamins 2 weeks before the surgery. You can begin them again 2 weeks after the surgery. You don't have to worry. Deficiencies in vitamins happen over a long period of time. A month of not having vitamins and still eating, it's not going to cause any deficiencies. So it's very important that you follow these 2 steps. What can vitamins do? Vitamins will help with fatigue, muscle loss, blurred vision, nerve damage, hair loss. This is a big one. Vitamins will help with hair loss, and that's usually a question that I get for post-op. They can help with cracked and dry skin. You will overall feel better if you take vitamins, so you have more energy. The vitamin D and calcium citrate will help with weak and brittle bones, and just everything, all the vitamins will help with weakness in general. This is the ASMBS guidelines. So these are the bariatric vitamin requirements. What you can do is get a bariatric multivitamin, and this will be daily. It's a daily dosage. And these vitamins usually contain thiamine, zinc. They can contain vitamin D, and they can also contain iron with vitamin C. So it's all these four ones, so thiamine, zinc, vitamin D, and iron with vitamin C, they can be part of the multivitamin. This is what the BMVI means, bariatric multivitamin. Wherever you see that it can be taken from BMVI, it's part of the multivitamin. You don't have to take every individual one. Calcium citrate and vitamin D are also very important, and you have the dosages over here. These ones will come separate, and it's important that you separate the calcium citrate from iron, because iron and calcium citrate compete for absorption in our bodies. So if you take them at the same time, you're not going to get the full benefit of the vitamins. And also vitamin B12 is an important one. After the surgery, vitamin B12 will not be absorbed as easily because of the smaller stomach size or complete bypass of the stomach size, and absorption and the stomach and stomach acid is important for vitamin B12 absorption. So what you can do with this, it's either get a 500 to 1,000 micrograms sublingual pill. This is a pill that you put under your tongue, and you just let it dissolve, and that's how you get your vitamin B12. You can also get the 1 cc injection or a nasal spray. The injections, you would have to go to your primary care physician. They can offer that, and usually with the injections, you can do only one a month if you want to go that route. These are regular vitamins. I just went over it, but this is a little bit more detail. So multivitamin, you want to take them at least for the 6 to 12 months at least. This is for gastric sleeve patients. For the first 6 to 12 months is important. Any kind of bypass or duodenal switch, you need to take them forever, because then you have, with those two procedures, you will have malabsorption and also restriction. So the bypass, mini bypass, and duodenal switch, it's important that you take vitamins forever so you don't have any deficiencies. Calcium citrate plus vitamin D, it is important that it's calcium citrate, not carbonate. Calcium citrate is more easily absorbable by your body, and then vitamin D helps with calcium absorption. That's why they usually come together. Iron and vitamin C. Vitamin C helps with iron absorption in your body. Don't take iron and calcium at the same time. Like I say, they compete for absorption. And even if you want to get your iron from food sources, it's important that for example, spinach. Spinach is a great source of iron. However, the bioavailability of iron in spinach is low. The way you can improve that bioavailability and absorption is by having spinach with some sort of acid. So you can do spinach with a squeeze of lemon juice that will help absorb more iron from spinach. With iron from animal products, that's a little bit different. Iron from animal products is very easily absorbable by the body, so vitamin C is not necessarily required for that. And like I said, so sublingual B12, you can do your shots through your PCP if you want. It's once a month. And you can also do the oral supplements, the sublingual. You put it under your tongue and you let it dissolve. It does not need stomach acids. These ones will change depending on the brand that you do choose to go with. Our vitamin brand Emerge Bariatrics covers all requirements through these 4 vitamins. And I can go a little bit more in a bit about that. Vitamins and also protein are very important for hair loss or other deficiencies. These can happen in the first couple of months due to the rapid weight loss, lack of calories and protein, bad quality vitamins, or misunderstanding the vitamin schedule. If you do choose to go with the emerged vitamins, if you buy the ultimate kit, which comes with a multivitamin with iron and vitamin C, and the calcium citrate with vitamin D, those two bottles will cover everything, since our multivitamin has every other vitamin that you need in it. So you will only need the two bottles of vitamins. The schedule for this would be, if you do buy the from Emerge, in the morning you would take one of the chewable multivitamins, and then after that, in 2 hours, you have to wait 2 hours between iron and calcium, like I said. In 2 hours, you can start taking the calcium citrate with vitamin D, and you take 3 of the calcium citrate and vitamin D a day. So overall, you'll be taking 4 vitamins in a day. It's very important that you do it this way, and that way you make sure that everything is absorbed properly and nothing is competing for absorption. And you pretty much get the best value out of your vitamins. This is our website, Emerge Bariatrics. For new patients, we offer the first month of vitamins for free. These are the two balls that I was talking about, calcium citrate soft chew, and the complete multivitamin with iron. These two will cover everything you need. We offer the first month for free. All you have to do is pay for shipping, and shipping is $14.95. We will send you an email with this offer 2 days before the surgery. Unfortunately, any non-US patients, we cannot offer this. We cannot offer it to them because we cannot ship to other countries due to regulations from other governments. So the chewables that we have, they're very specific. They usually compare 4-to-1 to generic vitamins. So we have 4 times the amount of vitamins in our vitamins compared to the generic over-the-counter vitamins. So compared to like the Centrum one a day, it has a lot more vitamins in it. Like I said, because after the surgery, there's a problem with absorption. You need a lot more of the vitamins to make sure you get your requirements. You can fill all the vitamin requirements with iron, calcium, multivitamin, and B12. They are very easily absorbed by your body. They use sugar alcohols instead of regular sugar. So sugar alcohols don't get absorbed by your body that well. They don't have the same calories as the normal sugars or normal vitamins, because generic chewable or gummy vitamins are too high in sugar. And like I said, for gastric sleeve patients, we recommend taking the vitamins for 6 to 12 months post-op. For any kind of bypass, RNY bypass, mini bypass, or the duodenal switch, it's recommended that you take them forever because absorption is a lot more difficult with those two procedures. We also have some soft chews. So think about a Starburst. That's exactly the texture of it. It's the newest and most popular form of vitamin. We have a couple of options on our website. The vitamin comes in strawberry. The iron comes in tropical citrus, and the calcium, caramel, and watermelon. Well, I think we added a couple more options. And then, like I said, they fill all the vitamin requirements, and they're very easy for your body to absorb. We also have a drinkable vitamin. It's mixed with water. With this one, you will have to do 2 scoops a day instead of 1 if you do get the chewables. They have a lot of high-level multivitamins. They also come with some calcium citrate, 4 grams of soluble fiber, and we have 50 milligrams of electrolyte blend. And also, vitamins in liquid form bypass the digestive process, and they're absorbed directly into the bloodstream. The liquid formula should not upset your stomach. The other forms of vitamins, if you take them too soon, they can upset your stomach just because of the concentration. So if you do take it too soon, or the first time you take it, you get an upset stomach, it's okay. It's just the fact that they're very concentrated, and your stomach is still healing at that point. So if it does happen that you do take them and you get an upset stomach, I recommend waiting a couple more days and try it again. Like I said, you don't have to worry about the deficiencies. They don't happen that quickly. So if you need more time, take more time to heal and to make sure everything goes okay. We also have a meal replacement. This is great for the pre-op if you like. They're very good flavors. I've heard nothing but good things about them. They taste like milkshakes pretty much. They come with 27 grams of protein, a complete protein too, 450 milligrams of calcium, zinc, biotin. It does have 15 servings, less than 5 grams of sugar. And like I said, they do taste like milkshakes or smoothies. They're very good. These are great if you're in a rush and you want to just replace a meal during the day. You can just have 1 scoop of this and then you'll be fine. It will help with satiation and hunger. So yeah, these are great actually. I recommend them. This is what I was talking about, how our vitamins or bariatric vitamins in general have a lot more nutrients in it. As you can see, if you compare the vitamins, for example, thiamine, which is one of the requirements for post-op, it has 12 milligrams of thiamine, which is what you need. The Centrum Adult Multivitamin only has 1.5 milligrams of thiamine, and the gummies have 0. The same thing goes for folic acid. You can see it's almost double or even triple the amounts. Biotin is the same. It has a lot more biotin in it compared to the generic ones. Vitamin D and zinc, same thing. A lot more of the things you need after the surgery. Flintstone vitamins, I get this a lot. They are not a great source of vitamins. They don't have any thiamine in it. They don't have any folic acid, or the folic acid is low. Zinc is not sufficient. Vitamin D is too low. And as I was mentioning before, they have 3 grams of sugar per 2 gummies. So if you had to get enough Flintstone gummies to get to your requirements, you can see how the sugar content can add up, and it's just going to slow your weight loss progress. I generally avoid them. I recommend that people avoid them. So yeah, a bariatric multivitamin will be a lot better. I also get questions about patches. Patches are good, but they have led, the studies show that patches lead to more vitamin deficiencies. In a small study, the vitamin patch group had more deficiencies than the oral supplement group. So if you want to supplement your vitamin intake with patches, that's fine. But I would recommend getting the actual bariatric multivitamins instead of the patches. If you do want to get patches, for example, patches you can use during the clear liquid because they technically don't, you don't ingest them. You just put a patch on and that's enough. But it's not a good source of vitamins for the long term. After the surgery, digestion will be a thing that you have to look out for. So for improved digestion, I recommend digestive enzymes because post-surgery, you do not have the same digestive enzymes. These can help with preventing nausea and as well increase absorption of nutrients, and they also help break down food and digest food. I recommend a papaya digestive enzyme. That's the best one you can get. And also you can start probiotics also. Recommended, it's 50 billion CFUs or higher. And also just make sure you get as many strains as possible. This helps with a healthy balance of bacteria in your gut system. It aids with digestion. It can boost your immune system. And studies are showing that a higher amount of weight loss is associated with people that supplement with probiotics. And probiotics also can help with a higher absorption of B12. One probiotic that I do like to recommend is called Align. It has very high amounts of CFUs, and I think it has 5 or 7 strains of the bacteria. We're going to do another check your knowledge. I'm going to start the poll right now. Sorry, give me 1 second. Okay, we're gonna wait another minute. Go ahead and try to answer the questions, and then we can go over them after the 1 minute has passed. Another 30 seconds. Looks like most of you have answered, and most of them are correct. We're going to end the poll, and I'm going to go over the answers. So, are over-the-counter multivitamins sufficient for post-op? They're not in terms of the generic vitamins. Bariatric-specific vitamins have a lot more of the vitamins in the product. It will cover everything you need. So I highly recommend you get a bariatric-specific vitamin, not just an over-the-counter generic multivitamin. In long term, the generic over-the-counter multivitamins will lead to deficiencies and possibly hair loss, and also just lower energy overall. And then the next question is, which vitamins should you take 2 hours apart from each other? The answer is iron and calcium. Iron and calcium compete for absorption in your body, so you want to take them at least 2 hours apart. Here are some tips and tricks that can help you with the pre-op. Drinking a glass of lemon water first thing in the morning. Lemon water is great for even bad breath. It can help with bad breath. It can start your day. You can start your day hydrated. It tastes delicious. It can keep you hydrated. Make sure you stay hydrated. Drink water if you're feeling thirsty. And then eat enough healthy carbs and adequate amounts of protein and fat. Another thing that I encounter a lot with people starting the pre-op vitamins, a lot of the people all of a sudden are not eating enough carbs or processed carbs, so their bodies are showing it by you start having headaches, you don't have energy. You don't have to worry about that. If you just stay on the diet, you will get better. Your body will adapt to the new way of eating. If you do have a diabetic diet or anything pre-existing diet, please follow the pre-existing diet. So if you're a diabetic, you need to eat carbs. You need to have that sugar. We can work together to find the best solution for you. Just let me know and I can help you with it. And then having a light breakfast, that's also very good. It will prevent you from overeating during the day. It's going to start your day good. You're going to start with the nutrients that you need. And then you have to lower your overall fat intake. I'm not necessarily speaking about healthy fats. I'm talking more about processed oils, seed oils, processed foods, processed meats. You want to avoid all that, and that's how you lower your fat intake. It's best if you cook your own meals. You can control the amount of things that go in it. You can control the level of salt, sugar, carbs, proteins, and even the kind of oils that you put in it. So I recommend cooking your own meals. If you want to get something prepared and you're not sure if it's okay for the pre-op, you're more than welcome to send me a picture of it over text or email, and I can tell you if it's okay or not. Make sure you chew your food well and eat slowly, and try to eat without any distractions. Chewing food well and eating slowly is important, especially after the surgery. You want to chew your food to a baby food consistency. It will help with you swallowing, and overall, your body's gonna know you're eating. And try not to eat with no distractions, because eating with distractions can lead to overeating. You're not realizing how much you're eating if you're watching something or if you're doing something else while you're eating. It's just better if you eat without distractions. Your body will give you better cues if you're not distracted. So if you start feeling full, you're going to feel it faster compared to if you, let's say you're watching a show and eating, you're not going to realize if you're full or not. Try to start exercising regularly for even on pre-op. It's going to help you lose weight. It's going to help you shrink your liver. And it's very important for after the surgery. You want to exercise regularly, even if it's just 5 minutes of walking every day. That's great. You don't have to go over the top with it. Don't eat before sleeping. If you eat and lay down, acid reflux can happen, especially after the surgery. So it's best if you eat a couple hours before you go to sleep, and try to get at least 6 to 8 hours of sleep for better bodily functions. You will recover faster after the surgery. So it's just overall sleep is great. Here are some sources that you can look at. We have a podcast. It's done by our past patients. You can get their perspective and experience of having surgery at MBC. We talk about a lot of things that are related to bariatric surgery. They talk about the pre-op diet, post-op diet, exercising after weight loss surgery, and also how to navigate fast food and returning to work after the surgery. You find on YouTube, our websites, Spotify, Google, Apple Podcasts, anywhere pretty much. Or you can just go on our website, and it's mexicobariatriccenter.com/podcast. We also have a lot of valuable information in our blogs. So if you're wondering about something, you can go and search it here. You can, for example, how to beat a stall. You can search it, and we have a couple of articles about that. Blogs are important. Our YouTube channel also has the podcast and also the pre-op and post-op webinars. So if you want to revisit it, we will post it on the YouTube channel. Facebook, Instagram, and TikTok are also great sources of inspiration. We have a lot of support Facebook groups. So if you want to have some peers with you, or if you want to talk about what to eat or what not to eat, you can visit our Facebook support groups and join them. And it's just a good community place that you can talk to other people that are going to have the same surgery as you are. We're going to go to the Q&A, but before this, I want to mention that this Saturday at 10 a.m. PST, we will have a webinar with Dr. Rodriguez. You can sign up for it, and if you watch and stay towards the end of it, you can enter a raffle that will give you a $2,000 off of the surgery. But make sure you tune in and stay to the end, and then you can win $2,000 off your surgery. Now I'm gonna answer some questions. So please post any questions that you might have. I see that Michelle already asked me something. If I lose weight prior to my 6-week pre-op diet to get down to 40 BMI, can I start the pre-op diet at 3 weeks instead? So if you do that, please contact your patient coordinator. They will work with you. You can even get a refund on if you have a higher BMI and lose weight before the surgery, you can get a refund on the higher BMI fee. So yeah, or you can just message me and I can direct you to the right people. What about IV vitamins? IV vitamins are great. If you're having a problem swallowing the chewable or the soft chews, or even if you have a problem with hydration, IV bars are a great source that you can use. You can go to any IV bar. You can do the hydration ones. You can do the vitamin ones. Yeah, those are great. Yeah, so if you want to do that, you're more than welcome to. Some other questions that I get regularly are about collagen and biotin. Collagen, it's more than okay to use. Just don't treat it as a complete protein. Collagen is missing one of the amino acids. So it's best if you just do a protein shake or a protein powder for protein. But the collagen is great for your skin. It's great for your hair. If you want to do that, you can do it. Just supplement it with the protein powder or protein shakes. Yeah. Oh, and biotin. Biotin is also great for your hair. Hi, Sam. Hi, Jay. I'm from Canada, but want to try the vitamins you talked about. Is it possible to ship to Canada? Unfortunately, it is not at this moment. We are working on a way to ship to Canada. And the reason we cannot ship to Canada or pretty much any other country, it's because regulations based on food. Like, for example, the FDA allows a lot more vitamins compared to the Canadian government. So it's a little bit of a tricky situation. I've had patients order them and then ship them to somebody that lives in America or the US. And then from there, you can ship it yourself. Unfortunately, the shipping costs can be pretty high if you do that. Um, but yeah, but any kind of bariatric vitamins should match your requirements. They have to follow the guidelines, the ASMBS guidelines. So they need to have the right amounts in it. I'm getting dental work done after the surgery. How can I grind up the food in the meantime? Depends on how soon after the surgery you're getting it done, because the first 2 weeks you're gonna be doing clear liquids or thick liquids. So the first week is clear liquid, so pretty much just water, broth, protein water, sugar-free popsicles, sugar-free Jello, and then the second week you can introduce more things like Greek yogurt. You can do blended soups. So if it's in those 2 weeks, it should be fine because everything should be drinkable in those 2 weeks. But after that, you would either have to make sure you mash them to a soft food consistency, or continue with the clear liquid or the thick liquid diet for a longer period. You can also, if you want more information, maybe you can message our medical liaison, Jen. She can maybe help you more with that. But also, you can ask your dentist on how to proceed after that. Very dry skin now, what can I take? So for dry skin, protein is important. Protein helps with skin cracking and dry skin. The vitamins will be very important for you after. Biotin is great to take after for your skin. And then also the collagen protein is very good to take for your skin health. Isn't the raffle surgeon specific? Um, Please contact your patient coordinator. I'm not sure if it's surgeon specific. Um, if you want, you can email me after this webinar is done and I can get that information for you. But right now, I don't know exactly, to be honest with you. You're welcome, Jay. How much water should we be drinking pre-op? 64 ounces is the minimum for pre-op. It's the requirement for the post-op too. That's generally the guidelines for water intake, 64 ounces. Hi, Sasha. Can I eat grits? No, grits are made out of corn or hominy. Those are both very starchy vegetables. So no, you cannot have grits on the pre-op. And also, I get this question a lot for the post-op. It's the same answer for the post-op. You cannot have grits. They're very hard to digest, and they might cause complications. Hi, Jalen. What about oatmeal? No, no oatmeal for the pre-op. You can have oatmeal on the week 2 of post-op. Oatmeal is very starchy. Same thing. It doesn't really have that much nutrient value either. So for the pre-op, you avoid oatmeal. Okay. If you guys have any other questions, please email me at nutrition@mexicobariatriccenter.com, or you can call me at my direct line right here. I'm more than happy to answer any questions, no matter what it is. Please contact me. I'm more than happy to answer them and help you guys navigate this difficult process. How much weight is possible to lose after 30 days? Depends. It depends on individuals. Sometimes I get people that lose a lot of weight super fast. Sometimes I get people that lose it slowly, but they still do it. Um, it will depend. Depends if you follow the guidelines correctly also, and if you are uh, losing weight at a slow rate, or if you're stalling, you can always contact me and I can work with you. We'll figure out a way to either speed up the process or make sure you get back on track. So please don't hesitate to contact me. Yes, the protein blend is okay on the pre-op and the post-op. Just don't do the protein blend on the clear liquids. Clear liquids, it's a bit different. Please try to use protein waters for the clear liquids, or protein or whey isolate. That's also very good for clear liquid. It's a food journal, good idea. Yes, that's a great idea. I recommend tracking what you eat. That way you can keep yourself accountable. And then also, if you are having troubles losing weight, I need to see that information so I can help you better. I need to see what you're eating, how much you're eating, and so on. What complications are well known after the surgery? Um, right after the surgery, you might have trouble with swallowing and drinking. You will feel like you're full all the time since you're changing your stomach. Um, Water intake should be a priority. Some other symptoms can be vomiting or nausea. Dumping syndrome is something that can happen after the surgery if you're not careful. What else? Hair loss can be a problem. You can become lactose intolerant after the surgery. It happens rarely, but it's a possibility. That's the only things that are coming on the top of my head. Sasha, you would have to attend the webinar on Saturday at 10 a.m. PST. Do I take laxative before the surgeries? No, you don't have to. You can if you want to. Is passing gas painful after the surgery? Not passing gas is just more. It's going to be more of a stomach gas, and it's going to be difficult for you to like burp it out and stuff like that. The magic soup recipe is great. Yes, the magic soup recipe is great. I highly recommend it for pre-op and post-op. Do we need to purchase the tourism insurance? It's never a bad thing. It does. If something does happen, you can use it. You can contact your patient coordinator for more information about the medical insurance, the tourism insurance. Okay. Thank you so much for attending. This is all for today. If you have any more questions, please email me or text me or call me, and I'll be more than happy to help you. Thank you so much for attending, and I'll help you with your weight loss progress. Thank you. Have a good day.